Good evening and welcome to the Frontliners. Social distancing, face shield, isolation, and quarantine. The coronavirus pandemic is putting words in the mouths of millions of people worldwide. They see the words quickly becoming part of our daily terminology as the deaths of the disease of COVID-19 surpass 500,000 people around the world. And to continue spread, to stay tuned after this. The prevention sector at the Kuwait Fire Service Directorate played a big role since the beginning of the pandemic by monitoring 62 different quarantine facilities around Kuwait. They have been inspecting all quarantine facilities such as hotels, resorts, and campuses, as well as examination of field hospitals and primary examination centers. To know furthermore and their work, let's explore after this.
حاليا احنا متواجدين في الجمعيات التعاونيه. حاليا تم التفتيش على اغلبيه المحافظات، تم التفتيش على جميع الجمعيات الموجوده بكل المحافظه. طبعا احنا حاليا يكون التركيز على شنو؟ على المخازن اللي موجوده داخل الجمعيات. انا كل جمعيه عندي حاليا في تخزين بسبب الاوضاع اللي احنا فيها، فيكون التخزين اكثر من الحد المسموح فيه. بس حاليا نشوف الاخوان هنا بالجمعيه حولوا التخزين اللي موجود حق المدارس، وهذا هم بعد شيء ساعدنا احنا في الاداره عام الاطفاء حق المواقع هذه، ان التخزين ما راح يكون بكثافه وبكميه الكبيره اللي قاعد تشوفونها. نشكر جميع الاخوان اللي بالجمعيات التعاونيه سواء رؤساء مجلس الاداره واعضاء مجلس الاداره، جدا كانوا متعاونين معنا ومتواجدين في الاماكن، وحفظ الله الكويت وشعبها من كل مكروه.
To know more about the efforts of the prevention sector during the coronavirus crisis, we would like to welcome Brigadier Abdullah Doseri, Director of Al-Farwaniya Governorate Prevention Sector.
Yes, hello, how are you?
Welcome to the program. First of all, we would like to talk about the role of the prevention sector during the coronavirus and the quarantine facilities outbreak. How did they manage to make sure that they go through the prevention sector rules and regulations?
First of all, thank you for the interview, and I'd like to welcome your viewers. Our job in general in prevention sector is protection of human and property. And this since the quarantine, I mean the corona outbreak, our work never stopped. You know, so we started from beginning, from first day, where we went to the strategic food storage areas for the government with the Ministry of Commerce. We inspected them to make sure everything is ready in case of fire or any other safety issues. And the other things, we went to also the field hospitals all over Kuwait, because it's temporary hospitals and quarantines. And also from beginning, also went to the initial testing in Kuwait airports for the evacuation or return and safe citizens of Kuwait from before the evacuation plan until it finished. We were there. So this is in general what we done through this outbreak.
We know there is a great effort was given by the prevention sector during the quarantine. Let's talk a little bit more about the collaboration between the prevention sector and, like you mentioned, the Ministry of Trade in supervising the warehouses that belongs to the co-ops. Since we noticed there was new warehouses were built during the coronavirus.
Yes, and it's called the strategic food storages. It's in many areas in Kuwait, and we make sure that it's safety-wise, it's safe in case of, because this is a strategic place for the whole government, and so we went through this. It took us many days from beginning, since the corona started. So we make sure everything is in order. To make it safe and proper for working and for everybody. Yeah, and our work is not with Ministry of Commerce. We worked with many ministries and all they cooperate all together.
Let's talk about the cooperation. To what extent did you evaluate their cooperation in applying the firefighter codes, as we know? Because all of these properties are valuable and they should go through the regulation and procedures to ensure they will be safe in the future.
Yes, the cooperation is perfect. It's from day one. And this storage is it's not just when the outbreak of corona started looking at their safety. It's been worked many years, for this. To make them sure from a long time, so we do this annually for these places. And when the outbreak comes, we make sure there's nothing will go wrong, because it's, this situation or this epidemic is need a lot of work and a lot of cooperation from everybody.
Correct. I'm sure that's a great effort and procedures that have been following up between the cooperation from the Kuwait Fire Service Directorate and the other governmental entities. Let's talk about some of the areas in Kuwait were on full lockdown. I noticed that the prevention sector played a role in delivering the gas cylinders during this quarantine to these areas. Can you talk a little bit more about that?
Yes, and we cooperate with the tankers, and for the company for tankers, they provided the gas cylinders, and we make sure that they are up to standard. and because they bottom all areas that locked down, and everywhere they want to put these cylinders, so we make sure they are in safety, and we follow up with them all the time. So it's like 24 hours job.
That's extra efforts. Great. That's some extra efforts, right?
And that's our job.
Let's move on into a very important question. Some of these quarantine areas, there's a lot of employees from different governmental sectors. We noticed that the prevention sector played a role in training and providing these employees with some safety guidelines. Can you talk about the training that took place?
Yes, in the quarantines, first thing we do, we check the places, for the safety. It should be supplied with fire extinguisher, hose reels, and if they have a sprinkler system, we make sure everything is ready. We train them how to use them, and plus we are there with them, just in case. That's so it's been long, the whole long of the outbreak. We there and still we still with them. It's our job, and that's at least we do.
A tremendous effort has been given from the Kuwait Fire Service Directorate during the quarantine area. Let's talk about one kind of service that it's been lately given for the public, which is the online services. Is there any procedures talking about the online services, visiting the website to follow up on their paperwork?
Yes, we have this website is a government website. It's the whole ministry is there, and also with fire department, with the prevention sector is there also. They take appointment through this site, and through that appointment they can come with their barcode, and we give them all services, and everything is like normal. Just take precaution.
Brigadier, can you mention what's the website? It's called Meta.
It's called meta.gov.kuwait.
Great. So all of the people that need to do any kind of follow-up procedures with the prevention sector, they could go through this website, correct?
Yes, they can take appointment, and they can come anytime, and they're welcome.
Any last words you'd like to tell our viewers about the prevention sector, Brigadier Abdullah?
Yes, I'd like to tell everybody, just, we're open, and they can come anytime, just take appointment, and we service them like before. It's nothing changed, just this issues is just for protection from, from the corona, not to be infected for our, customer, or they're coming to us, or from our employees. And also they have to take the proper protection. They could follow up, in fire department Instagram. We have all the precautions, and everything is there.
Thank you, Brigadier Abdullah Al-Dosiri, Director of Farwaniya Governorate Prevention Sector at the Kuwait Fire Service Directorate.
Thank you very much, and hope to see you again.
We'll go on a short break, and we'll be back after this. Currently, no vaccination available to treat COVID-19. Therefore, restricted public health measures such as isolation, physical distance, and quarantine have been used in a number of countries to reduce the spread of the virus. Similarly, in Kuwait, no exception. We would like to welcome Dr. Dhari Al-Hashash, Director of Mishraf Field Hospital from the Ministry of Health. Dr. Dhari.
Hello, good afternoon.
Hello and welcome to the program. We would like to first talk about the efforts that have been given from the Ministry of Health about how many quarantine facilities were established by the ministry lately since the outbreak.
Well, since this pandemic crisis, Ministry of Health established many quarantines, such as in Al Abdali, in Khiran, in Al Jon, Seychelles, in Al Zor. Many quarantine facilities were established in order to control this pandemic crisis.
Great. Since this outbreak, we'll talk about, can you mention how many of them and the sizes? Are they all the same? Or there are some of them are field hospitals comparing to quarantine areas?
Well, regarding quarantine, we have the biggest quarantine in Kuwait, which is located near Jabir Stadium, established by the Ministry of Public Workers. It has a capacity over 5,000 beds. And also regarding field hospitals, also Ministry of Health established many field hospitals such as Mishraf Field Hospital, Kuwait Field Hospital, Al Jalib Field Hospital, and also Al Mahbula Field Hospital. Each of them has different capacity than another. For example, Mishraf Field Hospital, it is the biggest field hospital in Kuwait with a capacity of 1,200 beds, and it was established in the early of April 2020.
The establishment of the quarantine and the field hospital, I'm sure there was a cooperation between the Ministry of Health and other governmental entities. Can we talk about that a little bit?
Yes, of course. Many governmental facilities contributed in order to establish those field hospitals. For example, in Mishraf Field Hospitals, Ministry of Defense, Ministry of Finance, and Ministry of Oil, such as KOC and KIPIC, all of them collaborated in order to establish Mishraf Field Hospital.
Great. I'm sure along with the Kuwait Fire Service Directorate as well, they have a temporary center to ensure the safety of the patients.
Yes, of course, of course, of course. The fire station, the firemen, the policemen, also the Ministry of Health itself was providing us with the medical equipment, medical staff, medications needed in order to control this pandemic crisis.
We moved from phase 1 and now we're in phase 2. What's the expectations? And tell us more about the patients. And it's a huge risk among doctors, you and your squad, since you guys knowing on a daily basis you're going inside these warehouses or you're going inside these quarantine areas in the fairground, and knowing you're dealing with a positive patient face to face.
Well, it is our duty as doctors, okay, serving this humanity in order to fight this pandemic crisis. So actually, yes, we are going on daily basis to monitor those patients and doing routinely checkups upon all of them, okay, and managing them according to protocols provided by the Ministry of Health.
Great. What would you tell your staff, a word of appreciation, I mean, with the great efforts now it's been given in the past few months dealing with this crisis?
Well, I'd like to thank all the people working in Mishraf Field Hospital, such as doctors, nurses, lab technicians, radiology technicians, pharmacists, administrations, the volunteers, the policemen, the firemen, all of those people. really deserve a big thank you for them all. Those people left their families away, kept away from their families, living in home isolation, just in order to put their maximum effort in working in this field hospital. So they really deserve a big thank you.
I personally would like to thank you on behalf of the Kuwait Fire Service Directorate for the great efforts you and the squad that you are working with. But before we go, can you tell me what's your expectation as a doctor, a supervisor responsible about Mishraf Fairground? Is it going to be better in the future? And the number of patients, is it on the increase or the decrease side? And after the patients leave the hospital, do you give them certain guidelines to make sure that they never come back and they live a safe life?
Well, I think everybody is responsible here. We all share equal responsibility, either people working in Ministry of Health or the patients themselves. We need to assure that we keep social distancing, wearing surgical masks, and not going out unless it's necessarily in order to control this number. It is our responsibility either to increase it or to decrease it by obeying those recommendations.
Any last words you would like to give, or any guidelines you'd like to tell our viewers to make sure they live in a safe life?
Well, it is like two simple things I'd like everybody to know and to really stick to. Keep social distancing, keep wearing your mask, and don't go out unless it is necessary. That's it.
We would like to thank Dr. Dari Al-Hashash, Director of Mishraf Field Hospital from the Ministry of Health. We'll go on a short break and we'll be back. Stay tuned. One of the greatest feelings a person could go through is when you give your country and don't expect anything in exchange. That's where a volunteer comes in place. Every person throughout his life could volunteer for a purpose. And today we have a special guest. We would like to welcome Dr. Abdullah Jasm Al-Gattan from the Mishraf Field Hospital. Let's talk a little bit more about his efforts and what he went through as a volunteer doctor.
Thank you very much.
First of all, I noticed that you are a doctor specialized in the field and you volunteered. It's rare that we know that people could volunteer, especially during the pandemic. Can you tell us a little bit more, where did you volunteer and how did you start?
Firstly, I would to thank all of you and the crew for this opportunity to be in this TV show. Initially, I start on half of April on the airport to access people who came from outside and to help them for swab. So I was in the airport work as swabber. We worked there for 2 weeks. Then after finishing of that, they spoke with me that we have a shortage in the quarantine of Jabir Hospital. So I went there. I worked there for 3 to 4 days. Then they contact with me back that, doctor, we have another shortage in the stadium of Jabir and we need you there. So I went there also to work for 2 to 3 days. Then they called me Mishraf Field Hospital. We have another shortage, so we need you as expert there. So I worked there until now. I'm there. So more than 2 months, I'm working on Mission Field Hospital so far.
It's a tremendous work, and we praise what you're doing as a doctor, especially in the field. I'm sure you face some challenges since you've been to one place to another, quarantine from the airport, moving all the way to Mishraf Field Hospital and other areas as well. Can you tell us about the challenges and what your expectations from one place to another?
Yeah, part of challenges, I think it is not only for me, for a lot of doctors that we face it, that almost all the doctors, and because of shortage and this pandemic, that we are dealing with the new diseases, and all of us that we don't know how that virus initially works and why started all of those patients to be died and what is the source and the complication of that virus. So initially, and because of all of us that we came from another subspecialty, for example, I am a general surgeon and I used to work with the surgery and not to go with medical issue. And my colleagues are a dentist and still they are working with us. They are great doctors also. So all of us that we are dealing with the new viruses and the new disease and we don't know that much, how come that virus deal and make that complication for patients? So Ministry of Health that understand that and she gave us that courses and how to deal with this disease, such as incubation and to deal with how to deal with the complication of this disease. This is the first challenge that we face it, and thanks for Ministry of Health that help us on that issue. Secondly, and that me and my colleagues also, that once you work with that field and you're dealing closely to the patient who's positive and diagnosed as a COVID-19, so once you will work with them, you will feel and you will be sure that one day you will be diagnosed as a positive for COVID-19.
Correct.
So you're afraid that once you will go back to home, you might transmit that virus for your family. So this is our nightmare every day that we, when we will go to the work, that we might transmit that virus to our family. So we discussed that issue with Dr. Bari and Ministry of Health, and thankful they gave us that hotel and apartment to be isolated, placed away from our family. So now we can work safely without afraid that we are the source of transmit that infection. I think those two main challenges that all of doctors face it initially with this pandemic disease.
I'm sure there's great efforts, and you're going through a lot of emotional feelings since you've been working for the past months, and there is a high risk as well as a frontliner. Every frontliner faces a risk, but you guys in the Ministry of Health, the manpower is great, and you've been expecting shortages because everybody was working day and at night. I know you talked about the emotional impact on your family as well. Can you tell us a little bit more after you leave work, going home? What's that feeling when you go home and you expect your family or your kids to hug you? I know it's hard because you're coming and you want to make sure that you also isolate yourself. You mentioned, yes, the Ministry of Health gave you an apartment, but in the beginning of the volunteering days, I'm sure every day you go home and you double think about it.
Yeah, you are right. Even before that apartment they gave us from the Ministry of Health, I was isolate myself in the home alone in my room, away from family. And once I started to be a volunteer, I sit with my family and I discussed with them that I will be away so far, and I don't know for how long that I will be away, but thankfully that they are so helpful that they used to pray for me, that we will be with all of the family issue. You have just to be focused in your work and how to help your people. That the most thankful after my father and my mother, that my wife, how she's such a nice wife that she gave me all the power that you can go. Don't worry about the child. I will be there. I will support you. Go and help people. So thanks for her. Plus, I have such emotional issue that my daughter, I have two little daughters, that one of them called Miriam, my little princess. She said one time, before 2 weeks, once she spoke with my family, and just before I go with that story, I spent maybe 3 months until now. I did not touch them and I did not hug them so far. So she started to tell my family that I have no father. So they started to tell her, why? Your father is dead. She said, no, my father is a doctor and he spent all the time with the patient, not with me, so I don't have father. Please give me a father. You can imagine that word was break my heart, but hopefully that pandemic will go soon.
I'm
and
sure.
Our
Definitely.
job, our patients and our people will be grateful in the future and from God.
Definitely, we are going to stay positive, and we're going to help one another. God bless your daughter and your family. I'm sure she will have a father, and your actions will speak on behalf of you and all of the volunteers. We'd like to thank Dr. Abdullah Jassim Al-Gattan from Mishrif Field Hospital. Since the emergence of the deadly pandemic, Kuwait Red Crescent Society focused their efforts to the families in need and underprivileged labor in the country as much support as possible. Kuwait Red Crescent distribute efforts have been targeting isolated areas due to the precautionary COVID-19 measures like Hawali, Jalib al-Shuyukh and other areas around the country. To know more about their efforts, stay tuned and we'll be back.
The Kuwait Red Crescent Society has been very active since the first diagnostic case in Kuwait on the 24th of February. We have been supporting the families and supporting the ministries in this pandemic. The Ministry of Health, from the very first, asked us to help them logistically to look after the 8 quarantine resorts. And we have been working 24/7 in the quarantine resorts, supporting the Ministry of Health. The second largest mission was when His Highness the Emir decided to let all the Kuwaitis come back home. There was a committee formed headed by the Ministry of Foreign Affairs, including all the ministries of Kuwait and the Kuwait Red Crescent Society, to help in bringing our nationals back. As you know, there were 50,000 Kuwaitis outside Kuwait, and the Emir wanted to bring them back for Ramadan, and it was a challenge. The Kuwait Red Crescent Society was involved in their return from the airport to take them home. We had over 102 cars and 4 or 5 cars for disabled and stretcher cases. We also took part in taking the PCR test of corona from the airport to 4 labs in the city. So this was the air. There was also a land one that involved about 4,000 Kuwaitis coming from Saudi Arabia. We also helped them to take them back home. They also helped the Ministry of Health to furnish 23 buildings, 115 flats, fully furnished them for their nurses. We have been also distributing food items to all the laborers that were in lockdown. We also distributed items for 5,000 families in Kuwait. So we have been working round the clock since the start of the COVID-19. And this is part of our humanitarian aid supporting the people and the government.
احنا جمعية الهلال الأحمر من بداية أزمة كورونا إلى يومنا هذا نقوم بتقديم المساعدات سواء للأسر المحتاجة أو للعمالة البسيطة اللي موجودة في المناطق المعزولة أو غير المناطق المعزولة، بالإضافة إلى دورنا كان في المحاجر، دورنا في المطار في عملية الإجلاء سواء كان في المطار أو في عبر منفذ نويصيب. هاي كلها كنا نقوم فيها، بالإضافة إلى تقديم الماسكات والجلوفز والمعقمات سواء كانت بالدور الرعاية أو المؤسسات الإصلاحية، بالإضافة إلى أن احنا قدمنا جزء من هذه الكمامات والمعقمات إلى مع بداية العمل في المرحلة الأولى في مجمع الوزارات والهيئة العامة في كذا مؤسسة حكومية داخل الكويت قدمنا لهم. اليوم احنا دورنا هني في دور الرعايه قاعدين نقدم بالتعاون مع هابيتات احدى منظمات الامم المتحده مكتبها بالكويت، قدمنا لهم ماسكات للموجودين في دور الرعايه سواء كان المسنين او الاطفال او الايتام، للكل الموجود داخل المؤسسه هذه.
I think the main message is that without volunteers, the Kuwait Red Crescent Society cannot work. They have been in the front lines of COVID-19. Some of our volunteers also contacted the coronavirus. However, they recovered, thankfully, and they have been really the forerunners of the Kuwait Red Crescent Society, and we appreciate what they did and thank them for their wonderful work, humanitarian work.
The Ministry of Health Public Works established one of the biggest quarantine facilities that can hold around 5,000 patients, located in Al-Ardiya near Jaber Stadium. The fire department assigned several of their staff members to secure the facility by preparing a temporary fire station with all the necessary equipment in case of any emergency. To learn more about the station, let's see this on the report.
بسم الله الرحمن الرحيم. تم تأسيس المركز الإطفاء اللي في محجر العرضية اللي هو الأستاذ جابر في نهاية شهر مارس، يعني مع بداية افتتاح المحجر. يعني الجهات اللي شاركت في تأسيس المحجر بداية وزارة الصحة، شركة البترول الوطنية، الحرس الوطني، طبعا الزون بقيادة الحرس الوطني وحراسته مع وزارة الداخلية، فتم تأسيسه بتعاون كل القطاعات. آلياتنا الموجودة بالمحجر هني آليات تستخدم للحريق وللإنقاذ. أحدث الآليات الموجودة بالمراكز هي نفسها تم الاستعانة فيها وتثبيتها في المركز الموجود متواجد بالمحجر هني. الحوادث اللي نستقبلها هني مستعدين لاستقبال حق أي حادث كان، سواء حادث بسيط أو حادث كبير لا قدر الله. ويسند المركز هذا مركزين قريبين من المنطقة هذه، مركز إطفاء جليب الشيوخ ومركز العرضية الصناعي، بالإضافة إلى جميع المعدات البسيطة للتدخل السريع مثل الإسعاف الأولي والأمور هذه متواجدة هنا مع الفرقة كاملة. الحوادث اللي واجهناها الحمد لله من بداية افتتاح المحجر مثل حوادث الإنقاذ البسيطة، مثل فتح باب، مثل ارتفاع درجة حرارة التكييف التعامل معه، وأيضا تم تدريب الطاقم الطبي الموجود هنا في حال وجود أي حادث بسيط، مثل يعني بداية الحادث مثل حريق بسيط أو شرارة أو أي كان، يتعاملون معاهم لحين إيصال المعلومة لنا هنا عشان التدخل. بالإضافة إلى ذلك تم وضع خطة لتحديد نقطة إخلاء بالموقع، مع نفس ما ذكرت أنه في تدريب صار للعاملين الموجودين هنا من الطاقم الطبي لتسيير المرضى لمكان أو العاملين الموجودين لنقطة إخلاء يتعاملون معاها لحين دخول رجال الإطفاء داخل الموقع الحادث والتعامل معاه. احنا طبعا الحمد لله مستعدين من ناحيه التعقيم مستمر عندنا مرتين باليوم عند دخول الزام، ايضا الى توفير الكمامات والمعقمات واللبسوس الجلافز موجوده، ومطبقين تعليمات والبروسيجر وزاره الصحه كامل. يعني العاملين الموجودين رجال الاطفاء عارفين البروسيجر شلون يطبقونه على طول. يعني طبعا احنا تعاملنا مع المحجر ومع كون يعني المحجر فيه مرضى وفي طاقم طبي يتعامل مع المرض نفسه، فتم توفير معدات التعقيم وادوات الوقايه مثل الكمام والجلافز وهذا، ومستمرين في عمليه التعقيم دائما. يعني باليوم من مرتين لثلاث مرات الشباب يعقمون نفسهم، وهذا الوقايه من المكان نفسه. يعني كان في ضغط نفسي بالبدايه لكن تغلبوا عليه الحمد لله، وحاليا عارفين يتعاملون معاه من غير اي يعني ضغط نفسي نفس ما كان بالبدايه، والامور الحمد لله يعني الحين بسهاله وصارت الوضع الطبيعي عندهم تقريبا. يعني طبعا انصح المشاهدين وانصح المواطنين والمقيمين الموجودين في البلد باتباع تعليمات واجراءات وزاره الصحه، لان وزاره الصحه حاليا هي قائد الازمه الحاليه بالمرض هذا، فبعد اتباع اجراءاتهم ان شاء الله الامور كلها تصير طيبه باذن الله.
We have reached the end of the episode, but before we go, every person in Kuwait is responsible. We need to team up and understand the responsibility, following the guidelines. Remember, Following the guidelines will lead us to move to the second and third phase. The government is putting tremendous amount of work. It's now the time for you to act. Goodbye.